Hi, everyone. Welcome. I am Dr. Lauren Kriz. I am a pelvic floor physical therapist. With me today, I have Dr. Summer Samhori, who is also a pelvic floor physical therapist and my partner in Tampa, Florida. And then we also have Dr. Adam Gvili. And we are all joining today in support of National Orgasm Awareness Day, which is July 31st. And so Adam has agreed to join us to talk about men's pelvic health, because, by the way, men have pelvic floors as well. So Dr. Adam Gvili is a doctor of physical therapy and the founder of Pelvis NYC, New York City's go-to clinic for men's pelvic health and sports performance. He specializes in helping men overcome complex issues such as pelvic pain, erectile dysfunction, post-prostatectomy recovery, urinary problems, and performance limitations that traditional approaches often miss. Through his unique blend of hands-on therapy, movement training, and nervous system retraining, Dr. Gvili and his team take patients from pain and dysfunction back to full confidence and peak performance, whether that's in the gym, in daily life, or in the bedroom. At Pelvis NYC, his mission is simple: to educate, empower, and guide men toward real solutions for problems most people are too embarrassed or unsure of how to talk about. So thanks for joining us.
Thank you for having me.
You are a bit of a unicorn, huh? There aren't very many male pelvic floor therapists in existence.
Yeah,
So
that's right. I'm not as tall as a unicorn, but I guess you would call me a bit of a
you're
unicorn.
missing the horn and maybe the sparkles as well. But
Really, I could use some of that. What? I've been treating male pelvic health since 2018. How did I get into it? I myself went through a pelvic floor dysfunction for about 6 years prior to that. And at the time, there was like nobody to treat it, or I shouldn't say nobody, but there were some great pelvic therapists that were treating it. Ultimately, it took me four pelvic floor providers until the last one helped me. They were all women. But what I noticed was that there was a gap in kind of like communication, and mainly because women don't have the same appendage as men. And so if I'm talking about erection and peeing standing up, these are things that you could do your best to relate, and ultimately you could have the know-how of whatever textbook it is you read, but you don't have that like intuitive sense of what's going on. So I think once I realized that gap and I noticed that I was able to get better through 6 years of uh, not, it wasn't fun, let's call it that. I was like, okay, let's do pelvic floor therapy, and we're here now.
okay, fantastic. So what are some of the common diagnoses that you see in your clinic when you're treating men? What do they come there for?
Yeah, so the I would say the average age group that we see, believe it or not, is 20 to 45. So this is very much a young man's issue, let's call it that. And then from there, it kind of skips to the, let's call it 60 and up, the post-prostatectomy crowd and BPH crowd. But for the most part, it's urinary frequency and urgency, groin pain, testicular pain, um, constipation, maybe any issues with fissures or hemorrhoids or post colorectal surgery. The list goes on. Procticalgia fugax, which is considered a rare diagnosis, although we've been seeing a little more of it. Erectile dysfunction, premature ejaculation, and we could continue with that list, so on and so on.
And hard flaccid, you recently talked about in your
Uh,
Instagram.
Hard flaccid, yeah, we see a lot of hard flaccid. Although it's interesting, that was a Reddit diagnosis that kind of like came into existence because most people just figured that that would be a good name. And now that it's actually a medically recognized diagnosis, which is interesting. Um, you were seeing a lot of heart flaccid, especially in the young men.
Yeah, I will say I can relate and agree to what you said in the sense that you're right. I am not a man, although I treat male pelvic floor dysfunction. There are certain things that maybe I can't fully relate to. And in all honesty, I never thought I would ask young men in my entire life how many times they masturbate per day.
Right.
I mean, there's just like things that never even crossed my mind that I would have these conversations. So I'm glad that there's somebody like you that, maybe they have a little more comfort level with seeing. Um,
Yeah, yeah. I mean, but let's not discount the fact that I got better by a woman. Yeah, I've just wanted to kind of bridge that gap between, I guess, what I have and how I can relate to someone else. That's all.
Very good. Now, when we
To
think about,
say, sorry to interrupt. I have to say, I've been a public PT for 15 years. I've never had a male patient say, "Gosh, I wish there was a male doing this." So I'm just curious, like, do you have men gravitate towards you because you're male?
That's the number one reason we hear people book with us. So, in most cases, I'm assuming if they only see female, then they're not going to be like, "Oh, I wish there was a
Right,
female," or I mean, I wish there was a male, because that's like telling the pilot, "I wish there was a different pilot." Like
right,
you don't want the person to be insecure when flying your plane or treating you. Um, but most guys, whether straight or gay or whatever it may be, are more comfortable. And what we find with other males, can I think they could relate, but ultimately, guys just want to get better. So whoever
right.
treats them, that's the most important thing. And if you have the know-how and the skills to do so, who cares?
Right.
yeah. So as we kind of pull it back to National Orgasm Awareness Day, what are some of the then, and I know you listed a whole bunch of diagnoses, but give me like one or two of the most common diagnoses that you might see related to that, and so how you might go about treating that patient.
Sure. So, I mean, the biggest one we see is premature ejaculation, right? It's the most common diagnosis in terms of orgasming. And the other spectrum of that is like people who take SSRIs who have the inability to orgasm from a male standpoint. So maybe we can help them kind of make that connection a bit better so they're not struggling as much. That's on that spectrum, that side of the spectrum. But when it comes to premature ejaculation, what we find is most of these men, as you would guess, are just increasingly hypertonic. So if we could downtrain their pelvic floor, get them to a point where they're no longer having that neurological clench and they can start to get that here, perhaps that can translate to the bedroom. And we find that in most cases it does.
Okay.
What the tricky part is when it comes to premature ejaculation for men, um, so I've been treating since 2018, and I guess anecdotally, what I could say is sometimes most of these men have erectile dysfunction as well. As a guy, I can tell you, I would rather finish quickly rather than lose my erection, because at that point you've actually completed the event, so to speak. Like there was no like wah wah, if that makes sense.
Right.
Um, and so I find that with most of my guys, and sometimes they can't discern the difference. So they just assume they have both.
Okay. And so, like, what would be some early warning signs for these men to know that they might have a pelvic floor dysfunction?
It's a good question. If you call me, because we always do a discovery call to see if you're appropriate, or if maybe, there's things that outside of our scope of practice, maybe you need to see a urologist or colorectal specialist. But if you come in and tell me, hey, I've had a long history of chronic constipation. I pee 10 to 20 times a day. I find that I'm not emptying fully when I pee. I notice that maybe my erection is sometimes at 70 to 80%. So it's still erect. I could use it to penetrate, but we're not 100% there. Um, I ejaculate prematurely at times. Like these are all kind of like the box within the clinical prediction rule that I would say you probably have a high tone pelvic floor. It's contributing to these symptoms.
Okay. Do you do internal exams on your with your patients?
Hell, I say hell yes because as a straight male and as like your average bro, that right, I want to make it clear that this is very important to getting anyone within the pelvic floor realm better. And so when I was going through a pelvic floor dysfunction, I would walk into some of these clinics and my therapist would be like, "Oh, we're not doing an internal today." I'm like, "Okay, I don't even know what that means." And I find in some of the groups that I'm in, some therapists they don't like doing it. And to be fair, those are muscles, just we're working on those muscles just like on any other muscles. So when you say, do you do it the internal, it's part of the plan of care. It's that's how we get people better here. That's why some of the manual we do is so skilled, because we know what we're doing.
Right. Um, do you find that so as a man who's a pelvic floor physical therapist doing an internal exam on another man, does that ever like cause a barrier for you?
How so?
do the men, are they agreeable to it? Or like you said, they just want to get better, so whatever, it is what it is, and you're a medical professional and all is well.
Yeah, seldomly, I mean, does it happen where the patient's like really awkward about it? And again, you just met me and I'm gonna stick my finger up your butt. That I get it. But at the same time, it's once we do it, I explain to them what we're doing. I have a diagram where I show them like, yeah, we put our finger through here. I'm working on these muscles, okay? People rectalis, people coccygeus, like, and I medicalize it for them. They also see a beautiful space. They're like, okay, this can't be some weird thing that I just walked into. And then we just shoot the shit, so to speak, and just converse on anything else. And after the first or second session, they already kind of see that maybe decrease in pain or increase in function, and they're already bought in.
Right.
Um, yeah,
Yeah, I mean, I will say, with even just in conversations, if because pelvic floor physical therapy comes up all the time, and just an outside conversation with my friends, right? I'm sure the same is true for you. People are like, "You do what?" And then the conversations
Mhm.
just go from there. But
right.
any man that I'm talking to, they are way more interested than women half the time. They have all the questions. They are
Right.
just engaged and then telling me their entire life story about their pelvic floor. And
Why
so,
do you think that is? Why do you
oh,
think they're so interested?
it's same thing that you said before. They want to get better, right? Like,
Right.
I think they're, and I mean, you tell me if I'm wrong, but I feel like there is sometimes more uh, desire to improve and get better than, you know, than women sometimes. Women are just like, oh, well, it's fine. I don't need to have sex. I don't care if I pee all the time. And men are like,
Sure.
well, I want to have sex. And
So much of our identity as a male is tied to our penis. And so let's say if there is no erectile dysfunction or premature ejaculation, but I'm peeing 20 times a day, that's going to affect me sexually and it's going to piss me off, so to speak, just the fact that I'm just bothered by something all day. But if it was my shoulder or my back, like I could kind of I put it on the wayside, you know? But so much of our identity as a male is tied to our penis. Um, I
And
think
no men want to sit in a wet pad all day either.
in a wet pad, that's for sure. I mean,
Right.
it's astonishing the amount of prostate surgeons that I speak to, and they're like they do no aftercare, and most of these guys are like I'm going through 3-4 diapers a day. I didn't even know pelvic floor therapy existed, and they get fully better. I mean, fully better. No pads. I mean, these are some of them are Fortune 50 CEOs that have to sit with diapers. I mean, it's
Right.
right. So for us, everything and anything is considered a quality of life issue, whether it's sexual, whether you bottom, top, whatever the hell it is. We just want to get you better. I see it no different as if you were coming in post-op ACL and we're teaching you how to use your vastus medialis, so to speak. You know, there's absolutely no difference. And if anything, I can argue we're on the forefront of something very interesting because no one teaches us how to void. Like we're not taught how to pee or poop,
Right.
or not as a guy, not clench when you get an erection, or people like to throw around these buzzwords of sympathetic, parasympathetic, but what does it really mean at the end of the day? And how do we teach people that without too many buzzwords and just making it simple and not over pathologizing them? That's where we come from here.
sounds like you make it very accessible for your patients to have conversations with you and just feel very kind of calm and natural about it.
This
So,
is in my eyes, it's part of the human experience.
yeah,
Sex, food, sleep. This is all things we need.
yeah, excellent. Um, so do you feel like thinking about the physicians, are they are you creating good relationships? Like, do you find that you're getting more and more referrals for male pelvic floor dysfunction, or do the men, your patients, typically find you on their own?
I would say 60% find this on their own, and 40% find this through physician referrals. The 60% that find this on our own happens because our SEO is great. We're like number one in New York City in terms of if you Google pelvic floor and stuff like that. So that helps us. But we only set up great relationships with doctors that can help our patients. So I will not go to a doctor's office just because he or she might refer us patients. If you're a doctor that, for instance, prescribes fluoroquinolones to your patients for 6 months, I don't even want to speak to you. That's out of my scope of practice, but we know that's 1970s urologic medicine. Yeah.
Okay.
Um, so, but we have great relationship with some amazing, amazing urologists that are great thinkers, and we use them as a resource even for ourselves. So, I would say it's about 60-40, and the others find this through either word of mouth or social media, Google.
Do you get female patients referred to you?
We do. At some point, I was treating a lot of female patients. Now we actually, so I treat males here. Then we also have Dr. Josh who treats males, and then we have Dr. Samantha Vargas who treats both males and females here. We're right on street level, so for us, like we were getting a lot of women that were coming in asking, "This is pelvic floor, like, okay, how do we get in?" And I think you're better off getting treated by someone who has the same parts as you. Of course, if you don't care, you get treated by anyone here. But yeah, we treat a lot of females here as well.
Okay. Fantastic. Summer, did you have any other questions?
No, I'm just curious about, just I guess the male to male interaction and whether or not you treated female patients. Like I said, I've been a PT forever, and I have not met a male pelvic PT here in Tampa. I know they exist, right? I've attended courses, but I'm really, I guess, impressed by how comfortable you make it, right,
I
for
went through
clients.
it, right? So like
You
I
went
think
through
that
it,
really helped.
right?
I think that
Right.
really helped. I had a lot of urinary frequency and urgency, constipation, the sexual dysfunction, not as much. But it was just like I was going to the bathroom like 16 times a day, couldn't figure it out. So I think that helps. I really do think it helps. You mentioned going to courses and you see men. I think the first course I went to, it was, let's call it, I don't know, maybe like 50 people, and I was one of two males there.
Right.
Every woman wanted to like feel a prostate, and at some point, I was like, "Everyone back off, no more. I can't handle it anymore." So yeah, that was one of my first courses.
Interesting. Lauren and I both teach at some local universities here, and I've had male patients ask if they can come shadow. And usually my first response is, well, I don't know how comfortable my female patients would feel if I had a male pelvic PT shadowing, And
Sure.
so what would your answer to that be?
I don't know. It's a tricky one. I think at some point, I mean, we just have to bite the bullet, and we're all professionals here, and we're all just trying to get our patients better. So how do we do that? I mean, we have to open the floodgates, so to speak, and it's not that big a deal.
Right.
The same question arises in a lot of these pelvic floor groups for women that are like, I feel uncomfortable doing skin rolling at the base of the penis. I feel uncomfortable doing internals. And my answer to that would be both male or female. I mean, just you shouldn't be treating pelvic floor patients.
Right. Right.
Um, take it as you may. I think our job is to make someone feel comfortable with treatment, and you have to be comfortable yourself.
Absolutely.
And that starts at the provider level. So maybe we need to do
Hmm.
that and get people comfortable with bodies, of course. So I don't have an answer for that.
Yeah. No, I think that answered it. I mean, Lauren and I both treat men, and I think every single time a male has left our clinic, they feel very comfortable, and they always say, "Thank you for making this so comfortable
Of
and not
course.
awkward." You
And they're
know.
also very excited when they leave or come in and there's other men in our clinic. They're like, wow, there's other men here. We're like, yeah.
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 So,
Yeah.
Yeah.
which is pretty neat. They're very happy with that.
But
No, I
I think the
understand. Go ahead. Sorry.
no, the reason for this interview is to make awareness, put awareness out there that there are male pelvic PTs. The patients can benefit from both female and male pelvic PTs. Just kind of making it less, normalizing it, making it not awkward, making it normal, making it more comfortable for male patients to come forward and say, "Hey, I need pelvic PT. This is normal."
Yeah. Yeah, for sure. I mean, I ask a lot of women, would you care going to a male gynecologist? And most are like, no, maybe some are more comfortable with a female, but I've spoken to enough that are just like, I don't care. I think men are the same. Some do prefer men over women, but you'll get both. You'll get carryover, of course.
Right. Absolutely. And Dr. Adam, is there anything else you wish people understood, especially men, about the connection between pelvic health and sexual well-being?
Yeah, stop doing Kegels. All these Instagram ads for like just do Kegels, your ejaculation will go away. Honestly, the best thing you could do for your erection is probably zone two cardio. Um, like bar none, just zone two cardio. Just go do it. Your erections will get better. Um, don't do a shitload of Kegels because at some point, people have to understand like length tension relationship, and in order for something to produce force, what muscles need to produce force, they need to be proper length, proper tension. So if you're Kegling all day, you're just not going to produce any force. Won't be able to compress the dorsal veins. Um, what else we got? Yeah, and you can get help. I mean, this isn't that serious, right? Go see a good pelvic floor therapist that's qualified in treating men
Yeah.
or women.
Since we're on the topic of sexual health, how do you feel about penile pumps?
I've tried them myself because if I was gonna tell my post-op post-prostatectomy patients to do it, I was like, I have to try it. What was the one we tried? The vacuum erect. I didn't love it, but again, some people have really good outcomes with it. And I think especially when it comes to stuff like that, like post-prostatectomy, you need good outcome measures. So that might be a good um I guess, and it's also great rehab for your penis. I would say maybe post-surgery, but someone who's younger, there's some good evidence to say if you have a hypertonic pelvic floor, you should probably shouldn't be using those penis pumps because it can further inflame the tissue. That's my take on it.
Thank you. I don't feel like there are great guidelines out there. I feel like I've had patients injure themselves,
Totally.
just kind of trying whatever they could try with it. So if
It's
you have
funny you
any
say that.
insight, share it.
No, it's funny you say that because when I called Vacuum Direct and I was like, how do I use this? And they're like, well, just go slow with it. And I was like, well, that's not really scientific considering like you guys are the go-to,
Experts,
yeah,
right?
experts. I'm like, I'm happy to work with you guys, but like talk to me here. Like, how am I supposed to use this? And they're like, pump, wait, pump, wait. I was like, okay, this isn't working. But I could totally see because as you guys know, men usually go from 0 to 100 real quick, yeah? And so that
Right?
means like they'll pump the crap out of that just so they can finally get an erection, especially if you haven't
Right.
had it for a while. So yeah, if your patients are going to use it, just make sure they err on the side of caution.
That is
Thank
great
you.
advice. Thank you.
What else? Yeah, I mean that's about it. Any other questions for me?
I don't think so.
Yeah, no, I think you've answered a lot of it.
Yeah.
Are you guys seeing an uptick in men down there in Tampa?
Absolutely.
Yeah,
And
I feel like I've had a pretty steady number of men. Sometimes, with any patient population, the clinic will ebb and flow with different populations and diagnoses and so forth. But I do feel like there needs to be way more education on men and pelvic health and that it exists and that they can get help. So I think if they start to feel more comfortable and know that it's a thing, that we'll get an uptick in patients just from that.
are you there? We have a physician here. Her name is Nicole Fleischman. She's at White Plains Hospital. Have you heard of her?
No, but I saw her on your Instagram.
Yeah, so we've been talking for a few weeks. I finally went to go visit the staff there. She was lovely. Like we sat for a solid 40 minutes. She wrote this book called The Second Mouth. She believes that everyone has some form of a pelvic floor dysfunction. I mean, being pelvic floor therapist, you can maybe see that that might be a thing. I don't
Right.
know, totally agree with that 100%, but she says exactly that, that we're not taught how to void properly as we age. So we just essentially push. And it was very interesting when I spoke to her because one of my theories when it comes to men is like we think that BPH is essentially idiopathic, right? We don't know why it happens. But if you think about it, if you ever stand next to a guy in the urinal, I don't know why that would be you, but most men
You never
are pushing to pee.
know.
We both have sons.
Oh, that's also okay. There you go. All right, fine. I have three daughters, so um, okay. So most men are pushing to pee, and actually, it's probably evident in younger kids because you hear them go, right? That's like a very common thing, and I think we're doing that for like 40 years, and essentially, what we're doing is hypertrophying the prostate. What's interesting is that 90% of the prostate is smooth muscle, 10% at the apex, right at the urethra, is skeletal. So I think we're hypertrophy
Forcing it,
and
forcing
forcing
it to
it.
work hard. Yeah, that's a
Um,
good point.
and
That's a
so that was
fascinating.
her point also, that
Yeah, fascinating fact.
we're all pushing for X amount of years. We're never taught how to fully relax our pelvic floor. And she coins it a developmental thing, right? Because what did she say? Don't kill me, Nicole, if you hear this. But she was saying we teach kids how to contract or stop their pee or hold it, but the releasing phase of it, we don't learn until adolescence or something like that because that requires your prefrontal cortex, and that's not developed in kids yet, which is really interesting. So we just learn how to push, and we take that for 30, 40 years or
Yeah,
whatever it will be.
Plus, everybody's
So
always in
I
a
think
rush too, right? Like everybody's like, quick, gotta
right.
get in, gotta get out. You know, they're like trying to force their urine out as quickly as possible because they can't just take, an extra second to pee properly.
well, as women and of course as moms, how many times have you done the just in case pee, right? Like I'm leaving the house with my kids,
Right,
and
right,
you're a therapist, and you're like, I should probably still pee because I'm going to be in the whatever.
No,
right, right.
not anymore.
Not
No,
anymore, not
Before I was
anymore
a
now.
public PT, maybe.
We know
Now
better.
I'm like, well, when was the last time you peed? No, well, we're gonna be somewhere. You don't need to
That's
pee
right.
right now.
right,
That's right.
right.
You
Yep.
know,
But
my daughter was in high school up until last year, and I told her, I said, she would hold her pee all day and come rushing home 7 hours later, holding her. And I would say, this is not healthy. So kids are not taught what normal peeing and pooping is. They're not taught how unhealthy it is to hold it for too long or to pee every 10 minutes. And so I said to her, I need to talk to the Board of Education and we need to go present this in high schools. And she was like, please wait till I graduate. Please don't do this.
it's really funny. It's great. I could
All
see my
right, so we're
daughter
all
saying the
gonna
same
start a
thing.
movement
Okay,
of
yeah.
Um,
teaching people how to relax and pee.
and pee normally. Yeah. This has been
Right?
Yeah.
very enlightening, Adam. Thank you.
No, please. I love this type of stuff. Yeah, it's great. You guys are doing great work.
Thank
Thank
you. You should
you.
come visit
You
us.
too. All right. Thank you so much.
Of course.
Thanks, Adam. Bye bye.